I'm Roxanne, and today I will be doing my presentation on tobacco use within the Aboriginal Australian community. The World Health Organization describes tobacco use as one of the biggest public health threats the world has ever faced, killing 6 billion people a year. Tobacco use is a major cause of premature death and death from cancer, cardiovascular disease, and pulmonary disease. It is a risk factor for respiratory tract infections, osteoporosis, reproductive disorders, adverse postoperative events, delayed wound healing, gastric ulcers, and diabetes. Smoking-related illness is a result of exposure to the toxins in tobacco smoke. Although nicotine plays a minor role in causing illness, addiction to nicotine is the proximate cause. While Australia is among one of the leading countries in reducing smoking rates through various health prevention and promotional activities, tobacco use rates remain high among Aboriginal Australians. 47% of Aboriginal Australians over the age of 15 are daily smokers, and up to 80% in some northern communities, compared to just 15% of the general Australian population. The Australian Institute of Health and Welfare describes tobacco use as a major preventable contributor to the gap in life expectancy between Aboriginal Australians and other Australians. In fact, if tobacco use within Aboriginal Australian communities was reduced to the same level as consumption within the general population, life expectancy could be increased by between 4 to 5 years. Okay, so some facts and figures. Tobacco use is the #1 cause of chronic disease among Aboriginal Australians. The prevalence of smoking-related cancer is 3 times higher in Aboriginal Australian communities compared to the general population. 20% of the Aboriginal Australian death rate is attributable to tobacco use. 147 is the average number of cigarettes smoked a week by Aboriginal Australians, compared to 101 of the general population. Up to 40% of Aboriginal Australians living in rural and remote communities are unaware of quit AIDS. 90% of Aboriginal Australian prisoners use tobacco daily. 52% of Aboriginal Australians use tobacco during pregnancy, and 2 Aboriginal Australians are diagnosed with lung cancer every day. Okay, so we'll just go over some factors contributing to the issue. So, #1, priorities other than quitting smoking. Tobacco isn't always perceived by community members to be a high priority when they are dealing with a wide range of health issues. It is the silent killer. For example, substance abuse is often given more attention, which, unlike tobacco, has more disruptive effects. Furthermore, mental health and substance abuse care providers believe tobacco use may alleviate patients' stress. However, research indicates that cessation of tobacco use can increase positive effects and reduce depression. Another factor is culture. Tobacco use in Australian Indigenous populations predates European contact. Bush tobacco, or patchouli, was chewed, and later the Masaikans, an Indonesian tribe, traded tobacco with pipes from people from northeast Arnhem Land. Post-colonisation, tobacco was used as a form of payment for Aboriginal Australians working on white settlements. Even today, cigarettes are used for bartering, for example, payment for a car ride into town. Another factor is socioeconomic inequity. A social gradient in tobacco use exists, whereby tobacco use rates rise as one moves down the socioeconomic scale. The National Aboriginal and Torres Strait Islander Health Survey 2004-05 found that those with a higher income had completed Year 12 and were employed were less likely to use tobacco. Another factor is less access to preventative care. Until the year 2000, no tobacco control programs had been developed specifically for Aboriginal Australians. Even where care is available, there may be some barriers to access, including language barriers, racism, and lack of Aboriginal Australian involvement in the delivery of health services. Another factor is dispossession. Dispossession and institutionalization and the trauma of separation and loss that resulted is linked to higher levels of risk-taking behaviours, such as tobacco use. Findings from the 2002 National Aboriginal and Torres Strait Islander Social Survey show that individuals who had been removed from their families were twice as likely to be tobacco users. Another factor is addiction. So, as for most tobacco users, Aboriginal Australians are addicted to nicotine. The nicotine in tobacco smoke induces pleasure while reducing stress and anxiety. It improves concentration, reaction time, and performance of certain tasks. Relief from withdrawal symptoms result in enhanced performance and mood. Cessation of smoking produces irritability, depressive mood, restlessness, and anxiety. So avoidance of withdrawal symptoms and enhancement of mood form the basis of addiction. So what is being done? Some great quit programs have been developed for Aboriginal Australians. Some include the Aboriginal Tobacco Control Project. The program aims to reduce smoking rates in Aboriginal Australian communities by providing information on how to quit and inspirational stories and those that have quit. I'm just going to show you a story now.
My name is Colin Williams and I come from Rockhampton and I live at Bankstown now. I quit smoking just of course my health, you know. I smoked about 50 a day, cigarettes. I tried lollies and I went cold turkey and that was it, you know. So it was over 20 years, so I haven't smoked for, 20 years. Feels good. The smoking, used to make me puff a bit, when I used to work, when I was working, and, when I go to run, puff like, well, now I can run now, even from my age, but I feel good. At least you can wake up in the morning and, like the smoke, you can't smell it now, go outside, you can smell the fresh air, and it feels so good to me, not smoking, that is.
Another program is nosmokes.com.au. So the website is a multimedia anti-smoking program that combines music, games and highly visual mediums to appeal to younger smokers within the Aboriginal Australian community. Okay, and another program is tackling Indigenous smoking, and so that program is a national program run by an Aboriginal Australian elder. It provides funding for regional activities aimed at preventing the uptake of smoking and encouraging individuals to quit. Okay, so in summary, tobacco use is a major cause of illness, disease, and premature death. While Australia has successfully reduced smoking rates in recent years through various public health interventions, smoking rates within the Australian Indigenous community remains high. That is 47% compared to 15% of the general population. It is imperative to reduce these rates in order to close the gap and improve health for our Indigenous populations. As I've highlighted, a number of great programs have been developed for and by Indigenous Australians. However, a number of factors need to be considered and addressed, such as access to care, social equity, culture, and health priorities. Thank you for listening.